Greetings. This video isn't just about health, it's about justice. It's about recognizing the deep-seated inequities that have plagued our society for generations. It's about understanding that health disparities are not just statistics. They are real lives affected by systemic neglect and discrimination. It's about Black Americans facing a health crisis fueled by inequality. These communities often lack access to quality health care, leading to higher rates of chronic illnesses and lower life expectancy. The healthcare system as it stands is failing them. They are more likely to suffer from preventable diseases. Conditions like hypertension, diabetes, and asthma are rampant, not because of genetic predisposition, but because of the lack of preventive care and education. The environment they live in, the food they have access to, and the stress they endure all contribute to this crisis. They are more likely to die younger. This is the reality. We must confront it. The loss of young lives is a tragedy that ripples through families and communities, leaving a void that can never be filled. Each death is a stark reminder of the urgent need for change. We must acknowledge the systemic barriers. These barriers are not just in healthcare, but in housing, education, and employment. They are interwoven into the fabric of our society, creating a web of disadvantage that is hard to escape. We must dismantle the structures that perpetuate these disparities. This isn't about blame. It's about accountability. It's about holding institutions and policymakers responsible for the inequities that exist and demanding that they take action to rectify them. It's about creating a future where everyone has a fair chance at health and well-being. Imagine a world where every child, regardless of their background, has access to nutritious food, safe environments, and quality health care. This is the vision we must strive for. This is a matter of life and death. The stakes couldn't be higher. Every moment of inaction is a moment where lives are lost, where potential is wasted, and where communities are left to suffer. We cannot afford to be silent. Silence is complicity. We must raise our voices, share our stories, and demand that our leaders listen and act. The power of collective action cannot be underestimated. We cannot afford to be complacent. Complacency is the enemy of progress. We must remain vigilant, continue to push for change, and hold those in power accountable for their actions and inactions. The time for action is now. We have the power to create a more just and equitable society. It starts with acknowledging the problem, educating ourselves and others, and taking concrete steps to address the disparities. Together we can make a difference. Hypertension or high blood pressure is a silent killer. It disproportionately affects Black Americans. They develop it earlier in life. They experience more severe complications. The statistics are alarming. Nearly 60% of Black adults have high blood pressure. This is significantly higher than the national average. The reasons are complex. They include genetics, diet, and stress. Systemic racism plays a role. Discrimination, poverty, and lack of access to healthcare contribute to the problem. This is not a coincidence. This is a direct result of systemic inequities. Diabetes is another chronic condition that plagues Black communities. They are twice as likely to develop type 2 diabetes. They are also more likely to suffer complications. Amputations, blindness, and kidney failure are more common. These complications are devastating. They impact quality of life and life expectancy. The statistics are grim. Factors include genetics, diet, and lack of physical activity. But access to health care is crucial. Early diagnosis and management are essential. We must address these disparities. Section 4, Dying to Give Life, the maternal mortality crisis. The issue of maternal mortality among Black women is a pressing and heartbreaking crisis that demands our immediate attention and action. Black women are 3 to 4 times more likely to die from pregnancy-related complications compared to their white counterparts. This alarming statistic is not just a number. It represents the lives of mothers, daughters, and sisters lost too soon. This is a national disgrace. The disparity in maternal mortality rates is a glaring example of the systemic inequities that pervade our healthcare system. It's a stark reminder of the systemic racism in healthcare. The reasons are multifaceted and deeply rooted in historical and ongoing discrimination. Implicit bias among healthcare providers often leads to Black women's pain and concerns being dismissed or underestimated. They include implicit bias, lack of access to quality care, and pre-existing conditions. Many Black women live in areas with limited access to prenatal and maternal health care services, which exacerbates the risks associated with pregnancy and childbirth. Black women are often not listened to. The concerns are dismissed. This must change. The healthcare system must prioritize the voices and experiences of Black women to ensure they receive the care they need and deserve. We need to listen to Black women. Their lived experiences and insights are invaluable in shaping policies and practices that can save lives. We need to believe them. Trusting Black women when they express concerns about their health is a crucial step in addressing this crisis. We need to provide them with the care they deserve. This means ensuring that healthcare providers are trained to recognize and address their own biases, and that Black women have access to comprehensive, culturally competent care. Their lives depend on it. Every mother deserves the chance to give birth safely and to be there for her child. By addressing the maternal mortality crisis among Black women, we can create a more just and equitable healthcare system for all. Section 5, the unequal fight cancer in Black America. Cancer is a disease that affects millions of people worldwide, but its impact is not felt equally across all communities. In Black America, the fight against cancer is particularly challenging. Cancer doesn't discriminate, but the healthcare system does. This systemic inequality means that Black Americans face unique obstacles when it comes to cancer diagnosis, treatment, and survival. Black Americans are more likely to be diagnosed with cancer at later stages. This late diagnosis often results in fewer treatment options and a lower chance of survival. The reasons for this are complex and multifaceted. They have lower survival rates. This is unacceptable. The disparity in survival rates is a stark reminder of the inequities that exist within our healthcare system. It is a call to action for all of us to address these injustices. Access to timely screenings and quality treatment is crucial. Yet, disparities persist. Many Black Americans do not have access to the same level of care as their white counterparts. This lack of access can be due to a variety of factors, including socioeconomic status, geographic location, and systemic racism. Socioeconomic factors, lack of insurance, and mistrust in the healthcare system play a role. These barriers prevent many Black Americans from receiving the care they need. The mistrust in the healthcare system is often rooted in a history of medical mistreatment and neglect. We must break down these barriers. Community health outreach programs and healthcare advocates are working tirelessly to address these issues. They are striving to provide education, resources, and support to those who need it most. We must ensure that everyone has an equal chance at fighting cancer. This means advocating for policy changes, increasing funding for cancer research and improving access to quality health care for all. No one should face a death sentence because of their race. It is our collective responsibility to ensure that every person, regardless of their background, has the opportunity to live a healthy and fulfilling life. Together, we can make a difference. Thank you for joining us on this Blackboard's journey. Please like, share, and subscribe. What would the world be without a song?